We really have some great speakers today. Both of them are from Lincoln University. Yes, diamonds from Lincoln University. And our first presenter is Dr. Jennifer McCord. She began her teaching career at Lincoln University in the Associate Degree Nursing Program in 2007 as an adjunct clinical faculty for psychosocial nursing and medical surgical nursing. She began teaching full-time in the Associate Degree Nursing Program in January 2010, teaching psychosocial nursing and medical surgical nursing. Jennifer was actively involved in transitioning the Associate in Applied Sciences nursing program to a 4-year pre-licensure baccalaureate nursing program. She became the department head for the School of Nursing in 2021. Her clinical background and work experience includes trauma, physical rehabilitation, education, and management. She is a certified rehabilitation registered nurse. Jennifer graduated from the University of Missouri-Columbia with a BSN and completed her MSN and PhD at the University of Missouri, Kansas City. She is a member of Sigma Theta Tau International, the Honor Society of Nursing, and Delta Kappa Gamma International Society for Key Women Educators. She is married with 2 children. In her spare time, she enjoys reading, gardening, cooking, and spending time outdoors with her family. Without further ado, please welcome Dr. Jennifer McCord.
Good morning. Thank you for that warm welcome. I am honored to present to you today on breast cancer awareness, with October being Breast Cancer Awareness Month. I'm not here to scare you, but I want to make you all aware of yourself. I think it's very, very important for all of us to listen to our bodies. We know our bodies best. And that goes for all women as well as all men, because the topic I'm talking about today is breast cancer. We predominantly think, oh, that happens in females, but breast cancer can also happen in the male, okay? So what is cancer? When everyone hears that word, panic kind of sets in, but cancer, I'm not sure why that's, okay. It is an abnormal, uncontrollable, continuous replication of cells. Our body's making cells all the time, but they're supposed to die off. In cancer, they continue to replicate, they stay alive, and they form that tumor. And that's what starts the cancerous tumor. So in breast cancer, when we see that abnormal, continuous, uncontrollable replication of cells is happening, but it's happening in breast tissue. Black women are more likely to die from breast cancer than women of any other racial or ethnic group. Experts believe that it is in part due to because 1 in every 5 Black women is diagnosed with a specific type of cancer called triple negative breast cancer. And that again happens in Black women more than any other racial group. Breast cancer is the leading cause of cancer-related deaths in the United States for Black and Hispanic women. Breast cancer is also the second leading cause of cancer-related deaths in the United States, following lung cancer. This is for Asian Pacific Islander women, American Indian, Alaska Native women, and white women. So the triple negative breast cancer, a lot of times in medicine, we abbreviate things. So it's often referred to as TNBC. And triple negative breast cancer accounts for about 10 to 15% of all breast cancers. The term triple negative breast cancer refers to the fact that the cancer cells don't have estrogen receptors or progesterone receptors. And they also either make too much or not enough of a protein called HER2. These cells test negative on all three tests. So when they're doing tests, there's no estrogen, there's no progesterone, and there's no H2 present. These cancers tend to be more common in women younger than the age of 40 who are Black and who have at least one breast cancer mutated gene. TNBC differs from the other types of invasive breast cancers in that they tend to grow very, very fast, have fewer treatment options, and tend to have a worse prognosis or outlook. In Missouri, breast cancer has the 4th highest incidence and mortality rate among cancers, and women in Missouri get breast cancer more than any other type of cancer except for skin cancer. Where can breast cancer develop? Basically in any potential tissue in the breast. So it can develop from the milk-producing glands called the lobule, ducts or passageways that drain milk from the lobules to the nipple. And cancer can then spread to the underarm, to the lymph nodes. And the lymph nodes are small organs that filter out the foreign substances in the body. Cancer then spread to the rest of the body from here. And the common sites are lung, liver, bone, and brain. So risk of breast cancer, there are things that you can control and there are things that we can't control. So those are called modifiable and non-modifiable risk factors. So things that you can't control, a positive family history, and that's one or more blood relatives who have had breast or ovarian cancer. A genetic predisposition to the breast cancer 1 or the breast cancer 2 gene, your age, previous history of radiation to the chest wall, early menarche, less than 12 years of age, and that's starting your period before you're at the age of 12, your gender, and then late menopause. So those are all things that we can't control. But things that we can control are obesity, so our weight, our alcohol consumption, our smoking, and having children later in life or never having children. So how do we screen for breast cancer? The number one way is mammography. Mammography, there's also breast cancer MRI, a clinical breast exam, and then a self breast exam. Early detection means finding and diagnosing the disease earlier than if you would have waited until symptoms actually start. Cancer screening means checking a woman's breast tissue for cancer before there are signs and symptoms of the disease. Although breast cancer screening can't prevent cancer, it can help find breast cancer early when it's easiest to treat. Breast cancers found during screening exams are more likely to be smaller and less likely to spread outside the breast to the lymph nodes, the liver, the lung, bone, or the brain. The size of the breast cancer and how far it is spread are some of the most important factors in predicting the prognosis or the overall outlook of the woman or man with the disease. Mammography can help find some breast cancers early. And a mammography is an X-ray or a picture of the breast that doctors use to look for any signs of breast cancer. Regular mammographies are the best test doctors have to find breast cancer early, sometimes up to 3 years before it can actually be felt. And I have a very close relative that participated in an early detection mammogram. She wasn't even 40. But it was part of her health insurance. And she said, "What do you think? Should I go do it?" And I said, "You might as well, it's free." And they found breast cancer. She had no outward signs. She didn't feel anything, but they were able to detect it on mammography. And she's alive today because of that early screening, no doubt. Mammography are the best ways to find cancer early when it's easiest to treat and before it's big enough to feel or cause symptoms. Having regular mammograms can lower the risk of dying from breast cancer. So there's a lot of information on this slide. But the American Cancer Society is where we get a lot of our recommendations. And I have targeted this presentation to women, but it also does apply to men. So we have women who are of average risk. And then the next slide will talk about women who are of higher risk. So this means that the woman or the man does not have a personal history of breast cancer or a strong family history of breast cancer, a genetic mutation that is known to increase the risk of breast cancer. There are blood tests that can be done to test for that BRCA gene. And this person has not had any type of radiation to the chest before the age of 30. So women between the ages of 40 and 44 have the option to start screening with an annual mammogram. So a mammogram every year. Women between the ages of 45 to 54 should get a mammogram every year. So again, I want to emphasize that my loved one was before the age of 40. So it is still very, very important to start that screening early. Women 55 and older can switch to a mammogram every other year if they should choose. They can continue with yearly mammograms. Screening should continue as long as the woman is in good health and is expected to live at least 10 more years. Now, that's the American Cancer Society's guideline. I don't know if I'm going to live till tomorrow, but I hope I live another 10 years. So, again, that's the American Cancer Society's recommendation. All women should understand what to expect when getting a mammogram for breast cancer screening, what the test can and cannot do. Okay. And hopefully everybody in the room's had at least one mammogram. There have been great advances in mammography. There used to be very limited dimensions of how they could look at all the breast tissue. Now, most mammography is 3-dimensional, so they can get a very, very precise examination of all the skin tissue. So most mammograms are what we call 3D mammograms. In May 2023, the United States Preventive Services Task Force issued a new draft recommendations for breast cancer screening that notably lowered the age at which women should start screening from 50 to 40 years old, screening mammograms every other year from the age of 40 to 74 years of age. So the recommendations then for someone who would be considered high risk, and women who are at high risk would be those that have a lifetime risk of cancers of about 20 to 25% greater, according to a risk assessment tool, mainly based on family history. Someone who knows that they have the BRCA1 or the BRCA2 mutation gene, and that can be done through that genetic testing. Individuals who have a first-degree relative, a parent, brother, sister, or child with the BRCA1 or the BRCA2 gene mutation and have not had genetic testing themselves. You're at high risk if you've had radiation to the chest between the ages of 10 and 30. And then if you have Li-Fraumeni syndrome, Crowden syndrome, Brynan-Rayleigh Revaclibub syndrome, or have a first-degree relative of any one of these syndromes. Typically starting at age 30, high-risk women should have a breast MRI and a mammogram every year, not just the mammogram. Okay. The American Cancer Society recommends against MRI screening for women whose lifetime risk of breast cancer is less than 15%, just because of that extra exposure to radiation. So the MRI of the breast is not used for a woman who is at average risk. Okay. This is reserved for those individuals who are deemed at higher risk. Women at higher risk have a strong family history of the disease and have that inherited gene. The clinical breast exam. Okay, so this exam is done by a provider. Okay, so when you go to your provider, okay, they should be examining you. They should examine you Okay, just visually while you're sitting up. Okay, and then they should perform a physical exam when you are laying down. Okay, so when you're sitting up, they're looking for any abnormal tissue that you can see visually. They're looking to see if one breast appears significantly larger, if there's swelling, if there's any form of inflammation, any drainage from the nipple, anything like that. Then they should have you lie down and perform the physical exam of feeling in a circular motion for any abnormal tissue, any lumps or bumps, any tenderness, all the way through the entire breast, checking your underarm as well as your clavicle, okay? Because under your clavicle and in your armpit are where the lymph nodes are located. And with breast cancer, they can spread to your lymph nodes so that you will feel little nodules underneath the clavicle. Okay, so if you're going to the doctor for an annual exam and they do not do all of those things, please speak up and say, I want to make sure that I have a thorough clinical screening for my breast exam. Okay, the next thing that you can do is the self breast exam. Okay, and the best time to do this, you can do this in the shower when you're getting ready. It's best to do it the same day every month. Okay, and typically, if you have not had gone into menopause yet, the recommendation is to always perform it somewhere between 3 to 5 days after your period, or if you have gone into menopause, just set a date on the calendar. The 15th of every month, I'm going to perform my self breast exam and keep track of that. But as you're doing the self breast exam, okay, you're going to want to examine yourself in the mirror. Okay, you're going to put your arms to your side, look at your breast, and again, examine for any abnormalities. Okay, any swelling, any alteration in the skin tissue. Okay, then you're going to put your arms above your head, look at the breast again for any notable differences. Okay, and then your arms at your hips. Okay, because that kind of spreads the tissue out, so you might see a lump up high develop. Okay, then you're going to want to put your hand behind your head. Okay, and then with your fingers and your right hand, just gently press all around in a circular motion. Okay, going over the entire breast, just feeling for any abnormal lumps or bumps. Okay, especially if something is tender, you want to make note of that. Okay, I've had patients that immediately go get a marker and they mark on it and they come in and they say, Nurse Jennifer, this is where I felt the bump. Okay, or they will refer to it as an hour on the clock. I felt a lump at 2 o'clock or at 4 o'clock. Okay, and then you're going to do the same thing on the other side. Okay, and it's important that you perform these exams both while you're standing up and lying down, because when we're lying down, sometimes tissue readjusts and we can feel things that we wouldn't normally feel with gravity is at a different angle. But always feel the full area of the breast as well as your armpit for any swelling or lumps. So what to look for? And some of these photos are going to get a little explicit, and I apologize if it makes you squeamish, but I think it's very important because I think, you know, if I say, look for orange peel skin, well, what does that really look like? But when you see a picture, I think that helps us remember, oh my gosh, this is what I saw, and this is abnormal. Okay. So if you look very closely, and it's kind of hard to see on here, but there's a lump on this individual's breast. Okay, so we want to take note of that and notice any change in that size or shape if it's tender. So other things to look for, what we call nipple retraction. So normal breast nipples should be protruding. Okay, In breast cancer, the nipple will retract, so it will become inward, okay, as you see on the picture on the right. Okay, what we also want to look for is nipple discharge, okay? It can be bloody, it can be purulent. Any type of nipple discharge is abnormal unless the patient is lactating and you're breastfeeding. Okay, but we always want to be aware of any type of nipple discharge because that's not normal. Other things to look for, okay, changes in the skin's texture like dimpling or puckering. Okay, so if you look closely on the bottom left, I guess at the bottom right of this picture, there is some dimpling and some puckering. This area right here, that is not normal. Okay. We also see a retracted nipple. Okay. We see purulent discharge from the nipple, and then just the texture of the skin is what we call orange peel. So the tissue actually resembles that of the skin of an orange. Okay. And that is abnormal. So we can see that this tissue does not look the same as the tissue underneath or the tissue back here. Okay, so this is a very concerning breast exam and would more than likely indicate malignant cancer. Okay, breast cancer. Okay, pain can also be a symptom. So if you have breast tenderness, that is also an indication to go get checked. Rare signs to be aware of. Okay. Sometimes there aren't any distinct bumps or lumps. Okay. Like in my significant family history, she had no lumps or bumps. She just was like, hey, I'm going to go get a free screening today. And then, you know, within about 48 hours, her world was upside down. Okay. One breast suddenly larger than the other. Okay. Now, most breasts are not exactly the same. One breast will be a little larger, but if you are starting to see a significant difference in the size, that is concerning. The skin becomes thick, red, and pitted, or we see that orange peel skin. Warm, tender with a rash-like look. So the skin it doesn't look the same all the way across the breast. If it's itchy or you have shooting pain, and then swelling in the armpit, or you start to notice nodules in the clavicle area. So one of the non-invasive ways of finding cancer is using the whole breast screening ultrasound. Non-invasive ways means that there are no needles or anything like that involved. And if there is something suspicious on a mammogram, they may want to do a whole breast ultrasound. That way they're looking much deeper at all of the tissue of the breast. It's not usually done by itself to screen for breast cancer. Usually if you have a mammogram and something just doesn't look right, they're a little concerned, they will then send you for a whole breast screening ultrasound. So that's a step 2, okay? Doesn't mean that you have breast cancer, it just means that there's something on mammogram that's concerning, and that's the next step of stages. So I want to go over myths of breast cancer, okay? Number 1, only women with a family history of breast cancer are at risk. Okay, that is absolutely false. About 70% of women diagnosed with breast cancer have no identifiable risk factors at all. Okay, my loved one was a married mother of 2, ate so much more healthy than I did. You know, fruits and vegetables, had she's half the size of me, you know, exercise, very energetic, but had breast cancer before the age of 40. Myth number 2, Most breast lumps are cancerous. Okay. That is false. About 80% of the breast lumps are benign or non-cancerous. But that doesn't mean that we just push them off and say, oh, it's probably nothing. Okay. We monitor them, we get them checked because they can change. Myth number 3, breast cancer is not curable. Okay. 90% of early stage breast cancers are curable, often with breast conserving treatments. So some individuals will have a lumpectomy or that tumor removed. They will take oral medications, go through chemo or radiation, and be able to maintain the breast tissue. Okay. Other individuals, may opt to go ahead and have a unilateral mastectomy, removal of one breast, or a total mastectomy where they decide to remove both breasts. Okay. And then it's up to that individual person whether they want to have reconstructive surgery or implants. Myth number 4, only women get breast cancer. And I mentioned this when we started the presentation. For about every 135 cases in women, one man is diagnosed. Okay, and it's just not a disease that we really think about happening in men, but it can. Myth number 5, small-breasted women have a lesser chance of getting breast cancer. And breast cancer, it doesn't care. Okay, if you have large breasts, small breast, medium-sized breast, there's no connection between the size of a breast and the risk for breast cancer. Myth number 6, breast cancer always comes in the form of a lump. And this is, again, this is a myth. This is not true. A lump that may indicate breast cancer, but there are other breast changes a woman should be alert for that may be signs of cancer. And again, that's that change in tissue, the drainage from the nipple starting to retract into the tissue. Myth number 7, having a risk factor or several means you will definitely get the disease. Doesn't mean that you are destined for breast cancer. It does mean that you are at higher risk. Therefore, you should really take precautions. Get those mammograms annually, starting at the age of 40. Encouraging daughters, nieces, cousins, granddaughters to do self-breast exams and also seek treatment early. Myth number 8, your father's family history of breast cancer doesn't affect your risk as much as your mother's. That's not true. Okay, your father's family history of breast cancer is just as important as your mother's in understanding your risk. Okay, because we get our genetics from both sides of our family. Okay, and with the breast cancer, we can have breast cancer mutation 1, but if we have that gene from both sides of the family, that significantly increases our risk of developing breast cancer. Number 9, wearing antiperspirant increases your risk of getting breast cancer. Okay, and they have been doing studies on this since the 50s, 60s, and 70s. But to date, there is still no clear evidence to back up the connection between deodorant or antiperspirant use and breast cancer. And then myth number 10, caffeine causes breast cancer. There is no causal connection that has been found between drinking caffeine and getting breast cancer. Although we know that high diets of caffeine may increase lumps and bumps in our breast. Okay. Myth number 11, annual mammograms expose you to so much radiation that they increase your risk of cancer. Okay, this is false. Okay, radiation is used in mammography, but the amount is so small that the associated risks are tiny when compared to the huge preventative benefits reaped from the test. So what can you do? Number 1, reduce your weight. Okay, and that's so easy to say, but so very hard to do. Okay. But obesity increases our risk of not only breast cancer, but heart disease, diabetes, hypertension, especially in premenopausal women who have not had any type of hormone replacement therapy. So maintaining a healthy weight, increasing your activity, having a diet that is heavy in fruits and vegetables, whole grains, and balanced with the number of calories that you consume with your physical output is the best way to reduce your weight and reduce your risk of breast cancer. Eating a balanced diet, okay? Eating a balanced diet helps control your weight. Fruits, vegetables, whole grains, limiting caffeine, alcohol consumption are the best ways, okay? And then exercise. 20 minutes of walking every day is one of the best exercises that you can do. Women who exercise 4 or more times a week have a lower risk of breast cancer. The effect of exercise on breast cancer may be the greatest in premenopausal women who have a normal or lower body weight. And then avoid alcohol. Okay. Drinking alcohol increases the risk of breast cancer. The level of risk increases as the amount of alcohol consumption increases. So the more alcohol that's consumed, the greater the risk. Drinking alcohol also contributes to an individual having a higher breast density. So the structure of the breast becomes more dense. Women with very dense breast have a higher risk of breast cancer than women who have a low breast density. And then increased breast density is often an inherited trait, but it may also occur in women that have not had children, had a first pregnancy later in life, after the age of 35, or those who take postmenopausal hormones and drink alcohol. Smoking. Smoking is connected to virtually all types of cancers. And this doesn't help any cells in our body. The cancer with smoking, that nicotine can be carcinogenic and can cause cells to die. So reduced exposure of breast tissues to estrogen. Okay, so there are 2 things, breastfeeding, because breastfeeding encourages estrogen production, and then pregnancy at a young age. Individuals who have babies later in life have an increased risk of developing breast cancer. So decreasing the length of time a woman's breast is exposed to estrogen may help preventing breast cancer. So again, early pregnancies, women who have full-term pregnancies before age 20 have a lower risk of breast cancer than women who have not had children or who give birth to their first child after the age of 35. And then breastfeeding, estrogen levels may remain lower while a woman is breastfeeding. Women who breastfeed have a lower risk of breast cancer than women who have had children or did not breastfeed at all. Medications. So again, in medicine, we talk a lot of abbreviations or acronyms. And many of the medications that are used to treat breast cancer are called selective estrogen receptor modulators, or SERMs. Common medicines that you will see used are tamoxifen, Evista, and Fariston. The SERMs block your body's natural estrogen from binding with the cancer cells in the breast. By cutting off the supply of estrogen, the SERMs stop the estrogen receptor positive cancer from growing and spreading. So screening resources. Medicare Part B, okay, so the federal health insurance program for people who are over 65, certain younger people with disabilities and people with end-stage renal disease will cover 100% of the cost of a Pap test, a pelvic exam, and a breast exam for eligible participants once every 24 months. And we are hoping that this will change with that new guideline that says that there should be annual screening up until the age of 74. Screening resources, there are free breast cancer and cervical cancer screenings for Missouri women who meet eligibility requirements. Females who are at or below the 200% of federal poverty level for household income, ages 35 to 64 or older. Okay, I don't know why they put an age, a top age on that. Why don't they just say 35 and up? Okay, individuals who do not receive Medicare Part B or those who do not have health insurance coverage. The Show Me Health Women's Program offers free breast and cervical cancer screenings for Missouri women who meet the eligibility criteria. So women who have an income at or below the 200% of the federal poverty level for household income are at least age 35, do not receive Medicare B, and do not have insurance to cover the program services should qualify for the Show Me Healthy Women Program benefits. The Healthy Women benefit number is there on the screen and should be in your handout. It is 866-726-9926. And the poverty level, the 200% for a household of one, that annual income is $27,180. For a two-person household, the annual income is $36,620. For a three-person household, the annual income for qualification is $46,060. And for a four-person household, it's $55,500. Thank you. I don't know how I did on time.
Oh,
So-
you did perfect on time. We can go to the Q&A session now.
Perfect.
So I'm gonna borrow one of these mics.
That was a lot of information, and I hope I didn't overwhelm anyone.
Oh, no, we're gonna go to the satellite locations. Let's go to Kansas City. Kansas City, do you have any comments? Any questions? Kansas City.
Hold on, sorry. Yeah, let me let them unmute.
Please repeat the question.
Okay, now you can unmute. Sorry about that.
Okay, there's a question. What do you consider, what age is considered late menopause?
So late menopause actually kind of depends on when the person started their menarche or when they first started their period. But late menopause, 55 to 60.
Any other questions, Kansas City? No more questions in Kansas City.
All right, thank you, Kansas City.
And I
Thank
didn't
you.
follow the instruction very well. I was supposed to repeat the question.
But you did fine.
Okay.
Let's go to the east side of the state. St. Louis, you're up and on.
Yes, we do have a couple of questions.
Go ahead.
What type of screening do you have for men, since it's a possibility they can get breast cancer, I get mammograms, everything for women, but what type of testing do you have for them for prevention and women?
Can you repeat the question? It was very difficult to hear.
Yeah, she was asking, is there any testing for men?
So men do the mammogram as well. So all of the tests that I talked about for women are applicable to men. It's just a little more difficult and uncomfortable for a man when they're doing the mammography, because their breast tissue isn't as prominent as women's breast tissue.
We have one more question.
I see it says from age 40 to 74. What happens after 74?
You still go ahead and do those monthly screenings, and if you notice anything different, seek treatment.
Do you still have to give mammograms?
I would encourage continual mammograms on an annual basis or at least every 2 years.
One more question.
I don't have a question. What I advise for anybody that's over the age that they're saying, I advise you to catch those mammogram buses that you see that are around town to go and take a mammogram when you want to, because they say that you're not supposed to take them after the age of 74. But if you see a mammogram bus, please go and take it.
Yes.
Thank you.
There was a question in the chat that an individual had a mother with lung cancer as well as an aunt. Should they stay on top of their mammogram? Yes, absolutely. Do an annual mammogram. Also the self breast exam every month. Hugely important. And then all of the preventative things, limit your alcohol consumption, no smoking, healthy weight, balanced diet.
All right, thank you, St. Louis. Let's move on down to Southeast Missouri.
All right, Miss Yvonne, we have one more question, please.
Go ahead.
Under the medications, I think there were 4 listing on your screen that we don't have on.
The list of medications. Do you want me to repeat those? So tamoxifen, sorry, I've got to find my. Evista. And I've forgotten what the other one is. What did you? Nastrozole. So those that I listed were the most common. Remember, with breast cancer treatment, it is individualized to the patient, to the type of cancer they have, how aggressive it is. Some patients elect to take the tamoxifen, and they take it for a period of time. Some will not take an oral chemotherapeutic agent. They will do an IV chemotherapeutic. Some will have radiation only, and some will have surgery, chemotherapy, and radiation. And I'm trying to get to my screen where I had, because tamoxifen is probably the most common medication used to treat breast cancer. It can be taken orally. Farestone, Fareston was the third medication.
Let's move to Southeast Missouri.
Miss Yvonne, this is Patricia from St. Louis. We have one more question, just one more. Shoot.
May I interject, please? Miss Yvonne Matthews, the director of the Paula J. Carter Center, has joined us and she's here. Thank you, Miss Yvonne. She's here. I am Deborah Jenkins and St. Louis, you have another question? Go right ahead.
Yeah, I want to share my experience. During last year, I found my lump in my breast. And I went to the doctor, and this year, January 9, I had the operation, I had a lump. But it was under old, like they said. It's in time, it remains, so I'm 77, and I think we should do the every single year. Very important, and that's my message for everyone. Thank you.
Thank you. All right.
Back to the chat, the individual said, I am 30. Should I start now? Yes. Yes. Due to that positive history. Yes. And I wish you well on the cleaner diet. And with a cleaner diet, usually that diet, exercise, and weight will gradually come off.
All right, we're gonna move to Southeast Missouri. Sykeston.
I don't have any questions. I'm sorry.
To whom are we speaking to?
This is Jacqueline. I just didn't have any problem. I'm sorry. I didn't have any questions, but I'm also about 15 months post-surgery for breast cancer. And I would just encourage everyone to get a mammogram. And if you still don't feel comfortable, get a second opinion, get a second mammogram. And the treatments now are really individualized. So I can't say that breast cancer is good, but things are a lot better than they used to be, because I remember, when women had it years ago, it was just brutal, and it still is pretty brutal, but it's individualized, and you have a lot more options than women before us had. So be sure and get your mammograms and get a second one if you want to, and just take care of yourself and try to control your own health and do the research and, follow up. And I found that all of the professionals that work in that industry, the nurses, the technicians, they are all just wonderful people. So that's really, a bright spot to it. So just take care of yourself and get tested.
Thank you. Is that Miss Jacqueline McGee?
It is.
All right. Well, thank you. Yes, I'm learning voices and faces as well. But thank you very much.
Jacqueline, I wish you well in your recovery.
Absolutely. Absolutely. We are all survivors and fighters.
Thank you.
Let's see. Anyone else from the Southeast Missouri area? How about Sykeston?
Okay, we do have a question and a comment.
All right.
Speak loud, baby.
I would like to know more about the lymph nodes. They found cancer in my lymph nodes. They took some out, but they put me on limited fluids. But I'm still having pain under the armpit.
So if I'm understanding correctly, the individual had some lymph nodes removed and is still having pain. So I would return to your provider, because having those removed, the lymph nodes act as kind of a filter system. And when some are removed, the body still thinks that they're there and should be filtering, and fluid can develop. So a lot of times that we call that lymphedema, that can be painful. And we usually use some type of compression device, whether that's a wrap or a glove, or sometimes it can be in our legs, stockings. So I would encourage you to please go get that checked.
Okay, and the comment is that, Jacqueline kind of hit on what I was gonna comment on, which was about the fact that you all said 90% of breast cancers, if they're screened and caught early, are curable. And that is so astronomical based on past history. Okay, and that's great, but, do you have any numbers on women that are not getting screened? And then the next question is that, men are targeted, men can get breast cancer as well. I saw a commercial on TV in which that was mentioned, but what is a more, what ways are you all using to try to get men to participate in the screenings?
So when a man goes for, hopefully they are going and having an annual physical. Most of the times, just getting the gentleman to go see a doctor on an annual basis is a struggle. But that should be part of the annual screening or the annual physical. Just like they are having prostate screenings, they should be having prostate and breast cancer screenings.
Okay, and what about the women? Okay, go ahead.
I went through the prostate cancer thing. So like now I have to take the Lupron shot. Do women have to experience, do they have to take that particular shot also as far as the going through the cancer treatment thing? If I'm saying that correctly.
So if I'm understanding, Neupogen is a injection that is given to help increase red blood cell formation. We see that given with cancer patients because it can affect the ability for red blood cells to develop naturally, which red blood cells carry oxygen and iron. So when we don't have those things, we are tired, we have trouble breathing. We can also see the Neupogen in patients who have kidney disease, because our kidneys are what make the Neupogen, the natural occurring, it's called epigen, in our bodies. And sometimes the medications that we are taking can cause kidney damage, which doesn't produce the epigen. So it was kind of a long, kind of pathological question, answer to your question. But as long as the red blood cells are low, the Neupogen injection would be required.
They also have, they told me that next month will be my last. I won't have to take another shot after November. Is that, and also the hot flashes.
Mm-hmm.
That's part of it.
Yes, hot flashes, yes. But congratulations, your numbers must be coming up.
Yeah, they are, they really are. The General Bodine would say 0, 0, not.
Okay, and the other question was, do you all have a percentage of women who are not being screened and possibly are still dying from breast cancer?
I don't normally see those numbers published. Based on that 90%, they would then say that 10% were not. But as far as hard numbers, no. And that's very hard to detect. It's so important for all of us to encourage everyone we know. If they have breast, your body. Listen to your body. If you feel like something is not right, go to a provider. If that provider doesn't listen to you, go to a second provider. Because I am a firm believer that we know our bodies best. And when we feel out of sorts, we know something's not right. I can't put my finger on it, but something's not right.
Thank you.
Cannot
see it.
encourage that enough.
We'll see it.
Thank you, Southeast Missouri. Great questions from the area, from around the state. Let's move to Central Missouri. All right, if you're Zooming, if you have any comments or questions, please go ahead.
Well,
Good.
my name is Letha Jenkins, and I'm a twice over survivor of breast cancer.
Congratulations.
It's been 10 years. I went to my first appointment in 2013. I had a mammogram scheduled. According to my insurance, I don't have to wait until a year. It's bi-yearly. I can go in December and go back in January. So the nurse called me and said, you had one 6 months ago, so you don't need to come back, this soon. And by divine intervention, my spirit said, don't cancel your appointment. And I did not cancel that appointment. And I go every year for my mammogram. I want to encourage every woman on this line and man to go for your mammogram. And when I went, I got a call from the doctor. He said, can you and your husband come into the office? So I knew then that something was wrong. And mine is estrogen receptor. I did have a lumpectomy and radiation for 1 week, no chemo. I didn't have to have chemo, thank God. And I'm cancer-free today. It came back in 2017, but I believe in divine healing, and I'm healed today, and I am cured cancer-free today. But I want to encourage everyone to go get your mammograms.
Thank you.
Thank you very much, sister-in-law. I didn't want to put you on the spot, but that's a really good testimony. It really truly is. And I was hoping you would share. And is there anyone here that's in the room that would like to share or have a comment? Please do so at this time.
I have a question. So when I had benign continuation, I left breast. What, for a year, blood grew. They did a biopsy. They removed it. But I never had any medical treatment after that. Nothing. I just do yearly mammograms. Don't understand. Was it not necessary? Was it the fact that it was benign?
Because it was benign, but watching, because remember, there are benign, which means that we have that replication that it develops, but sometimes those tissues are not cancerous. So that's kind of like, thank you, versus those that replicate and are cancerous. So doing the regular mammograms and the checkup, but with the benign, those we continue to monitor and watch.
Well, I will say this, my mother did pass away from breast cancer, but it was advanced by the time she decided to get checked. And so it spread throughout. But out of 6 girls, I'm the only one.
Oh, wow.
That's had issues.
Uh-huh. Wow, that's amazing. Is everyone, and you may not want to share, but like very rigid with annual mammograms, self breast exams, everyone in the family? Because, when I talked about that, the BRCA gene, it would be important for all the women in your family to get tested. And, I have a very close friend that her mom, herself, and her sister were all diagnosed with breast cancer within the same year. Both the sisters have one single daughter. They both, everyone got tested for the BRCA gene. They don't have it. They don't have it. But so it was just, I guess, pure coincidence that all 3 of them developed breast cancer within the same year. But, one has to think, as young women, those daughters have to be very diligent, because just because the gene isn't there doesn't mean, I mean, you look at that risk factor and it is through the roof. So you're welcome.
This is, again, I have one more question. I did not qualify for the BRCA gene testing through my insurance. My mom was diagnosed at the age of 95 when she got breast cancer. So did that factor into why they denied it? And
Probably.
also, I mean, it's very important to have your family support and friends and church support. I thank God for my family, and I thank God for my husband, how he's by my side. That is very important. And a positive attitude takes you a long way.
Yes, it does. And I would, the guidelines are kind of constantly changing for the BRCA gene testing. That's something that I would revisit with your provider the next time you go in.
Amen, because that's today at 3:30.
Well, good luck.
We are doing.
There's a question.
There's
I
a
think
question.
there's one in the chat.
All right.
Okay. So there's a comment, birth control pills is the #1 cause of breast cancer. So birth control pills, that's where that estrogen comes in, okay? And if an individual has an early hysterectomy and goes on a hormone replacement therapy, that estrogen, that can be a risk factor. And then are inverted nipples automatically increase cancer risk? So no, but if someone is born and they have inverted nipples, no. If you have normal nipple formation and the nipple normally is extroverted, it points out, and then it starts to retract, that is abnormal and is a risk for breast cancer. Are there any research about why Black women have different receptors and how HER2 is made? Well, I'm glad you mentioned that, because many of the research documents that are out there do not include a lot of Black women. The research that is out there is not diverse. There are very few studies. So I guess my plea to all of you is, if you have an opportunity to participate in a research study, please do, because Black women are not well represented in the research that is out there. They just aren't. And that is from the Breast Cancer Foundation, that is from the CDC, and the American Cancer Society. The research that's out there is not diverse and is not inclusive.
Is there another question from the chat?
Let's see. My self-care last year with a breast cancer diagnosis included removing sugar consumption from my diet. No added sugars, no processed sugars, limited processed food. It's doable and the results are good. I'm 1 year post-treatment and doing well. Also remember to take care of your mental health, acknowledge the experience. And that's another good point. When women experience breast cancer, it can be very, very detrimental on the mental health and on our image as who we are. And having a support system and knowing that we are beautiful, no matter whether our breasts are there or they are synthetic, or they are big, they are small, they are medium-sized. As long as we are healthy, that's what matters. That's what matters. But but surround yourself with individuals, as mentioned earlier, with support. You know, my loved one didn't want to tell anybody. She was embarrassed. Okay. And actually had like her husband's uncle take her to one of her appointments because she was embarrassed. And it's like, what are you doing? We are like, no, we are going to be here. And then the follow-up, it is hugely important that if you have had breast surgery, a mastectomy, anytime you have healthcare, okay, they should not be taking a blood pressure in that affected side. They should not be starting an IV in that arm. And this individual was having surgery and I was with her and they started to come in and start an IV. And I was like, no, don't do that. And they were like, what? And I was like, she's had a mastectomy on that side. Do not touch her arm. You know, so we have to make sure that we continue to advocate for ourselves and for our loved ones in those situations.
I have a question to that. I had my, it was on my left side and I did not have any lymph nodes removed. So they said, as long as I didn't have the lymph nodes removed, it was okay to do the blood pressure and stuff and the blood drawing on that side.
They say it is okay. I would encourage them to do all of those things on the other side.
Okay, thanks.
All right, let's take a question from here in person.
I am a breast cancer survivor. I was diagnosed in 1989. I had my breast bleeding. I took chemo. And everything you just said about the hormone where you asked, I was gonna say that you already done. And if you love them, check them. You know what I'm saying?
Mm-hmm.
I was with the cancer survivor and I got a certificate to tell a friend. These are the women at my job. That's 13 women, more than that. 35-year-old, never have a mammogram. These the young women, I work with these people and they never have, and I was on TV back in the 80s. On Channel 13 for breast cancer. And the reason why I found the breast cancer was this little fellow right here. This was my cat. We were on the floor playing. She stepped on my breast and I was like, ow. And I said, something ain't right. So I went to the doctor, Dr. Hanson. And he couldn't find it. It was so tiny. So I finally found it and stuff like that. And then I had, you know, they come back in the room and say, yeah, it's breast cancer. So my son, he said, Mom, we need some, they not tell me something good. He took me to 3 doctors to make sure that's what it was before they did anything for me. And that's my buddy. He's gone, and she's gone now, and she died from breast cancer.
Oh my gosh.
I find hers in time. And when I did, hers was all over her.
Wow.
I mean, you know, things like that happen. And see, that's her and me in the bed. And that's how close we were. And I was like, girl, please, give me a break. Hot flashes and all. Come on now. And she like watermelon and cottage cheese. Because we are eating watermelon. You know, breast cancer is serious. You know, it's nothing to play with. And I tell anybody, any woman, do what you're supposed to do with yours. You know, they said if you nurse babies back in the day, you wouldn't get breast cancer. I nursed all my boys, and I ended up with it. My mother was a breast cancer survivor, but she's deceased now. She had hers when she was 42 years old. She went to the Barnes Hospital. After she went to the doctor's office, they took the lump out. She came home and hemorrhaged almost. That's back in the 40s. See, that's the way it was back then. And then when they did the surgery, removed the breast, they took it all the way down to her rib cage. You could knock on her rib like that. And then they put skin grafts from her thigh to cover my rib cage. I mean, man, it was just rough back then. You know, and you have these balls and you have this exercise, you go up the wall and all that. And my mom went through it, buddy, and I told her, I said, if I could just take your pain away, you could give it to me. And I had my breast cancer too. She was with me right here in Just City. The doctor over at Steel Hospital was on the second floor. They did chemo, not radiation. That was done in Columbia.
Yeah.
But they gave us all kind of dinners. They gave us makeup. They did wigs. They did the whole nine. But I don't know whether they're still doing that or not, whether they still got the meetings like they used, but I know we got, this is my first one for the American Cancer Society in '89. And I got every bit of them. I went to every meeting, everything they had going on, I went to. And this is one over there at the new center. That was some of my nurses and stuff. And Dr. Doggett, Dr. Hancock, he died from cancer. And he was my doctor, you know. And this is Dr. Doggett over there at Capital Region back in the day. And this is me, I'm gonna stop talking, but anyway, this is me going through chemo. I'm just knocked out, you know, just wasted. And this is me with my granddaughter that went through it with me. She didn't have no hair, she's born bald. This is me without the hair, and that's her with just born out of the hair. And she thought that was funny, but I said, okay, I'll let you have that, girl, but it ain't funny. Well, okay. And this is the office where I had the chemo at Steel Hospital. See, I've been there and done that. I tell anybody, get her done, girl. Don't wait around. I mean, you know, if your husband is fumbling around with your breath and hit something and he said, oh, honey, you just go. Don't stop, man. You know, it ain't no pity party. It ain't why me. It's get your life and what you need to do with your body.
Yes.
And you know your body better than anybody in the doctor, surgeon, specialist, or whatever. And if it ain't right, it ain't right.
Yes.
Thank you. And at first you was gonna be a little hesitant. I said, but you have a testimony. Yeah. You have a testimony. Please share that, because I'm sure someone will receive it today. Thank you for sharing that. And before we transition, please join me in a big round of applause for Dr. Jennifer McCoy.
I hope I answered your question.
Yes, you
She
did.
was the person that stepped in, but I think she did also. She did. You really did. You keep it up, girlfriend. At this time, before we transition to our second presenter, Miss Yvonne is here. She just said she only wanted to say hello. So at this time, she's going to say hello.
So as Ms. Deborah said, I've been allowed to say hello. And so I just wanted to greet you today. I am so glad. I've never heard Dr. McCord present. When Deborah said that she was available, I thought it would be real interesting to hear her. And so you did a good job. And when you do a good job, that means you'll be back. So to all the people who are joining us on the Zoom from all the satellite offices, good morning. We have two events going on at the same time. And so Sister Liz, Mysora, when you come up and do your presentation, I will sit as long as I can, but I have to get over to the farm to get to the next presentation. And I too am a breast cancer survivor.
Well, let's go ahead and transition to our second presenter today. Elizabeth, known as Miss Liz Morrow. Elizabeth Morrow received a Bachelor's of Science in Chemistry with a minor in mathematics and a Master's of Business Administration degree from Lincoln University. Yay. She obtained her Education Specialist degree from William Woods University, where she is currently completing her doctoral degree. Oh, yes. Elizabeth is the Student Resource Director at Lincoln University. And at Lincoln, she has served in numerous positions. She has a very positive, and this is so true, she has a very positive spirit that has been the source of her strength for every obstacle in her life, including her recent battle with breast cancer. She is a survivor and has been a tremendous support for others that are battling cancer. Without further ado, please welcome Miss Elizabeth Liz Morrow.
Okay. I'm gonna need some help with this PowerPoint. Before I begin, I want to say that I'll try to walk the walk and talk the talk. I had a mammogram yesterday, so to God be the glory. I have not heard back from them. Generally, it takes a couple of days, but I'm not expecting to hear back from them. I'm just expecting to receive a letter in the mail. So those that know, when you know, you know. There once was a woman that woke up one morning and realized she only had 3 strands of hair on her head. Did she get upset? No. She simply said, I guess I'll French braid my hair today. So she did, and she had a great day. The next day, the woman woke up, looked in the mirror, and realized she only had 2 strands of hair in her head. Was she upset? No. She said, I'm gonna part my hair down the middle and I'm gonna wear a bob. She did, and she had a great day. The next day, the woman woke up, looked in the mirror, and realized she only had 1 strand of hair on her head. Was she upset? Not at all. She said, I'm gonna get a ponytail holder, put my hair in a ponytail, and I'm gonna have a fun day. The next day, the woman woke up, looked in the mirror, and realized she didn't have any hair. She said, oh, well, at least I don't have to comb my hair today. That was a poem that I found in my doctor's office years ago. And that poem has stuck with me and been a part of my life. And that woman was me back in the days. And that's when I became, I'm bald, I'm bold, I am beautiful.
Yeah, yeah.
Thank you. Good morning, everyone. And to all of my fellow soror, not sorors, my fellow, I'm so used to speaking at another level, to my fellow survivors. I was asked to speak to you all today to briefly discuss my personal journey and to provide some inspiration. So let me put a few disclaimers out here. I am reliving my story. So in reliving my story, it comes with emotion and passion. So if I get emotional, just know that there are tears of joy.
I know it. Come on. It's all good. Come on. It's all good.
Because by the grace of God, I'm a 5-year survivor. Thank you. I'm glad I always tell them, make sure you have clinics. You just never know. This year, I just been so emotional. But like I said, I'm a very spiritual person. I give God all the glory. Let's see, a couple of disclaimers as I go through. There are gonna be some pictures that might be like she said, but they're me, they're my life, and they're my story. And I'll just explain them and move on. During this journey, I realized that my attitude has contributed to my outcome, every outcome. As you can see here, these are pictures of me prior to the diagnosis. Some of the things that I'm going to say are going to be repeated from what Dr. McCord has said. I was very active, healthy, not a drinker, not a smoker. In the white, as you can see, I had just celebrated my milestone birthday. Milestone to me was 50 years old. I had just turned 50 years of age. The other one is just me, just living my life, just driving. I'm known for being on social media, challenging everyone, burpees, health challenges, whatever kind of challenges. I'm the one that if you put a challenge out there, generally I'll take it. The other picture is me in the black. That's the day that I got that diagnosis, on December the 5th, 2017. And as mentioned, that poem was me. But nevertheless, my mantra became, I'm bald, I'm bold, and I'm beautiful. I've always had the attitude of being healthy, physically, mentally, and spiritually. Besides, I am not my hair. And my other mantra was, cancer, you got the right but the wrong one this time, because I am going to fight. Yes. I am going to share this story with any and everyone that I come in contact with. Next slide. Another thing too, before my first chemo, as she's mentioned, I'm a doctoral student. I had just finished, this was in October, I had just finished all of my doctoral classes. And in my mindset, I'm saying, oh, I'm going to write my dissertation. I'm going to start doing this. But when that chair called me, the only thing I can tell her was that I just got diagnosed with breast cancer. And she was like, whoa, she wasn't expecting to hear that. But I had to fight. This is the time, the holiday season, generally people celebrating with families and so forth. But no, this was a time that I had to fight for my life. And these are before chemo, as you can see, where I still had hair, natural hair, and so forth. And the other picture of me in the red, I was an award recipient, and they had given me a gift. But the thing is, that was me. Since I knew I had the attitude that I was going to lose my hair, I might as well just start playing with certain styles. So I actually had my hair cut, feathered into a different hairstyle, and as opposed to me just wearing it naturally. So you can see that. Okay, my story. I knew soon after I was diagnosed with breast cancer that I was not going to let it win. So after going in for a routine mammogram, November the 28th, 2017, shortly after finishing my doctoral degree classes, I was called back for a biopsy on December the 4th. And I had my mother. Support is amazing. I had my mother with me. But prior to that, one thing I neglected. After I finished taking my doctoral classes, my mom lost her only sister. So that's one death. Generally, you know, we were dealing with that. But then also 10 days later, her brother, she lost her brother. So there was 2 deaths in the family back to back. And we know death come in. I was not going to be number 3. So with that being said, me going through these exams and mammograms, I didn't want to tell my mom. Because I'm like, not only she's grieving her only sister, but she grieving her brother. And her brother, which is my uncle, died of a broken heart. Because when he saw on Chris the transition, he just gave up on life, because they used to be in the same facilities together and visit each other. So 1, 2, I was not number 3. So the biopsy had showed, prior to the biopsy, I had received a call from my gynecologist, Dr. Deffenbaugh. I don't know if anyone go to Capital Region, know Terry Deffenbaugh. She had called, her nurse had called, said, hey, when that diagnosis come, I want you in my office. I thought that was really, really good. And I assumed everyone was like that, but unbeknown to me, everyone do not get the cancer diagnosis from your doctor in person. There are so many, and I've done interviews, plenty, to whereas people have gotten the diagnosis over the phone. I can't even imagine, because I know some people have gotten a call and they said once they got the call, they want to just take their car into a ditch, you know, just drive it over a bridge. And I can understand, because, you know, your emotions are all over the place. Moving further, the biopsy had showed that the cancer was on the right side, and it was in 2 of my lymph nodes. However, I had to have 10 removed. But hearing those words, I cried plenty of tears just in that office momentarily, because I was in denial. And because I'm like, here I am, I'm healthy, I'm at the prime of my life, I'm living life, I'm doing good, doing everything right. Yet I have breast cancer. I had no symptoms, no signs, no lumps, and breast cancer was not even in my family. And when I say I was just living life, just, I mean, and I was living life so well to the point that I went to get a life insurance policy. And when I went to get the policy, and I'm not even sure what policy I was looking to get, they told me to test for this top-notch insurance. I went and passed the test, to whereas I was able to get a cheaper policy based on my health and my numbers and everything. So just imagine me dealing with all of this, and then to hear the words, you have cancer. Invasive ductal carcinoma, breast cancer to be exact. I knew those words affiliated with my name could never be a match. So as in the office, I called my best friend on the phone. My mom was right here with those pretty brown eyes. She's listening, being strong. The doctor was right there, and the doctor is asking my mom, who is she talking to? Because at this time, I'm talking to my best friend of 30 plus years, close to 40 plus years, and we're just crying. But all of a sudden, something came over me. I heard the voice of God to just say, I'm a very spiritual person, and I have a revelation. And it said, once again, cancer, you got the right, but the wrong one this time, because I'm going to share my story. I'm going to go on Facebook Live. I'm going public. And my doctor's response to my knowledge was, to my understanding was, good for you. And when I say I did it immediately, I did. I had to be strategic because, as she mentioned, I have numerous roles at Lincoln University previously. I was assistant dean of students at that time. And I knew I had to share my stories with the students, but I had to be strategic, but it was finals time. So I could not just put it out there. Their Miss Liz, Mama Liz, as they call me now, has cancer, because that would have just shut the finals down, because the people, they were connected. I have a very close relationship with the students. So my pastor, and that's the picture with the pink skirt, my pastor had called me home for prayer. And that Sunday, after I got diagnosed, that Sunday, I went home for prayer to have the elders to pray for me and so forth. Then I knew that next day that eventually I would be sharing, because the students were gone from the university. So they were here over, you know, while they're on their vacation. But one student called, and when she called, she was bawling. And I'm like, hey, what's going on? It was an alum, actually. She said, I thought you were dead. I said, oh, nope, it's time for me to go public. So I went public. I went out there and I put the longest post, and I mean, and it just shared, and everything. It pretty much just went viral, but people were calling and so forth. And I was just letting them know, like, hey, it's a lot going on right now, but I solicit your prayers. I thank you for your support. And one thing I say, if you get this diagnosis, or if you know someone to get it, don't look at the internet. It's too much on the internet. Like Dr. McCoy say, go to the American Cancer Society website, go to those reputable sites to get the information, because people, they want to be helpful, but they don't know how to approach you. I had people coming to me saying, well, yeah, my so-and-so or relative had, and they died. that's what you do not want to hear. So if you want to support someone, if you don't know what to say, research, like, should you say anything? Because if you can't say anything nice, my parents say, I know everyone in this room, you don't say nothing at all. Exactly. So I thought that was interesting. And another thing that I found interesting, and Dr. McCord can probably relate to that in various ones, when her loved one got it, some people kind of like shoo away from you. I don't know if they were thinking they could catch it too, or if they was just so hurt. So, they just didn't know if you were going to make it out or whatever. I had a very close loved one that was so close to me. It was just, I don't have any biological kid, but if I had one, she could have been my daughter. And she just didn't know what to do. She just clammed up in a shell. And at one of the events, I had to kind of free her and say, look at me. God has brought me to it. He's brought me through it. Look at me. And once I did that, I freed her. I allowed her to cry and so forth and to release that energy. This is before entering the chemo. That was just me taking a selfie before I left home. But then as you can see in the middle, right after my family, when I say I had support, I had so much support. Most people do chemo sitting in a chair. As you can see, I'm laying down in a room. They had to put me in a private room because I had so many people coming in. Once I got diagnosed and I had my family coming and asking all these questions and so forth, I asked a question simply. I'm like, okay, we had a list of questions to ask. I had nurses. I had all type of people. The doctor was like, man, you're in good hands. It's almost like anyone, a surgeon can do this and can perform it because, when you want to know something, you ask questions. You don't let people just do anything to your body. My doctor tell me, okay, Miss Educated, what do you want to know this time? So she generally has research for me every time I go somewhere. If they don't have it, I'm requesting it. So this is in the midst of me going live and expressing, hey, Facebook family, if you know me and you follow me, I greet everyone, Facebook family. This is Liz, and this is my first chemo and the whole 9 yards. But as you can tell, that chemo was very strong. It knocked me out. So I don't know if it was that Benadryl that they put in the tube, but I had a very aggressive, what's called the red devil. And that right there was very, very harsh on the body. And this is my family and I. You see me leaving that chemo treatment at that time, still smiling with my family and friends. Moving right along. Let's see. From going to my procedure consists of chemo, radiation, chemo, surgery, therapy, and radiation. Those were the 4 things. So as I talk, I'll probably allude back and forth to each of them. But from going to my first doctor's appointment through the next year, the battle with cancer, I took pictures, filmed videos. I spoke publicly at chemotherapy sessions, before and after surgery, radiation treatments. Every part of my journey was very public. And my fellow survivor was asking, do they still have those? Yes, they do still have the cancer group, to whereas you still can meet with everyone and you can still talk and you can discuss your story. I'm a faithful advocate, and I did all of my surgery here. My family thought I would go to St. Louis, but the doctors, I can say the doctors, surgeons, and everyone here in Jefferson City is just as great as opposed to going to St. Louis. So I did all of my treatments here. So I want to give a shout out to Capital Regional Medical Center for and Goldsmith, to where I did all of my treatments. However, while I was going through, the unknown was that I didn't know how I was going to react. Anything could have happened to me with all those chemicals being put into my body. But I was bold enough to take the stance and show people what chemo actually looked like, not knowing I would inspire people all over the world. That wasn't my intention. My intention was just to educate people about early detection. But if they follow my journey, they would see what chemo looks like, radiation looks like, doctor visits look like, the whole 9 yards. One thing that I was dealing with what chemo looked like. I had been a supporter of breast cancer, the Relay for Life, all those races for years, unbeknown to me that I would become a recipient of that. And now I participate as a survivor. So, and a lot of times I had students whose parents were going through chemo and so forth, but once they saw me going through it, I was informed that it helped them to not be as concerned as to what their parents was going through and what they were dealing with. They just basically said that it helped them just watching me go through my journey. And as social media would have it, I have thousands of followers watch. My mass was a size 4, so therefore that prompted the chemo first. Some people, if you hear, they might have surgery first, or they might not have chemo at all, and they might just have radiation, or they might just have surgery, but everybody's story is different. So after that, let's see. I would, as I was going through chemo, I had a mentor, because once I put it out on social media, I had a mentor that reached out to me through social media, and it's by who you know, through my brother, Herman Hobson. If you're listening, I want to give my brother a shout out for those of you that know Hop. She went to school with him, and she said, oh, I want to mentor your sister. And I thank God for her. Her name was Tammy Dunn. And I said it was because her cancer came back. Once you had cancer, be mindful that it can come back. Her cancer came back, and she transitioned in 2021. So I thank God for Tammy just getting me and helping me to get through it. You know, God puts people in your life for a reason, season, or a lifetime. And hers was a reason. You know, she had to help me get through, and I still honor her. And when I had chemo, one thing the doctor said, don't let it change you. I still wear my heels today. Sometimes I'm very weak. You know, I was weak going through that, but I would have students helping me. Just like, hey, I'm not taking these heels off for nobody. So I appreciate that. But also when my family, one of the questions they ask, because sometimes people go through and they take off work, they say, can she work? And that was one of the questions my family asked, because they know the type of energy I channel. And they were like, sure, it's based on each individual. So yes, I worked. I would go through chemo on Wednesday. On Thursday, Dr. McCoy was mentioning a shot, and someone on the satellite office was mentioning a shot. I had what's called an elasta, and that would help my cells bounce back. And on Friday is my low day. I was so low when I was with my caregivers, I would just lay on the floor. And another thing that one of the survivors said, she had a pet, and at my caregivers, they had a puppy. And in my room, you could just hear the puppy just scratching on the door. The puppy would just come in, and the puppy would just want me to rub her. And it was very therapeutic to have Cece. The caregiver was like, oh, I'm sorry, Cece bothered you. No, Cece is helping me. So I thank God for Cece too, the puppy. I want to give her a shout out. She was giving out shout outs to her cat. But and then on that Friday, that Saturday, Sunday, I was building back up, and I would be at work on Monday. And one thing I can say, I was wearing the mask before COVID. I have all type of masks that I was wearing, and I would wear it in a fashionable, the pink, the breast cancer, the ribbon, and so forth. And as you can see, after the chemo, eventually you lose your hair. But as you can see, I rocked the ball. I rocked it. I'm like, this is my new look. I'm gonna rock it. If I'm cold, or if it's cold outside, I'll put something over my head. But yeah, I rocked it. And then there's a picture of my brother Herman and one of my mentors, Mr. Scroggins. They cut their hair. They cut their hair. And if you can see Scroggins, he cut his eyebrows, every facial hair on his body that's visible, he cut just to support me in my fight and everything. And just the fact that if Liz can do it, I can do it. The one with the pink balloon, that was a surprise photo shoot that I didn't have a clue. I don't know how they kept anything from me, because if you know me, I'm in everything. I know everything. I was like, what? And then so that was just right after a chemo, which was crazy. But I was mustering, like I said, attitude is everything. I'm like, okay, they came to my house to pick out they bought the dress. I was gonna say, the only thing they came was picked out jewelry and so forth, and did a makeover. And I'm like, okay. And in the middle, as you can see, that's me in the middle. They're doing a pink ribbon. So that was so sweet when they had me in one room with the balloons and I walked out. And I walked in and just saw people from all over the world just there. I just bawled because that was my first time. I was actually fussing because there was an ladder in the ballroom, unbeknown to me that there was the photographer standing on top of the ladder to capture that picture. So I'm going into the ballroom like, what is this ladder in here doing? I didn't know it was a surprise photo shoot. And I walked into the room and lo and behold, it was just people just everywhere. So I thank God for the support and everything that I had in the midst. Let's see. Following my chemotherapy, I had to let my body heal, but in the midst, there are some side effects that I had, and the side effects varies for everyone. These were the 2 nails that I had, but this particular nail was the nail, the largest one. The nail actually had to be removed right after my surgery because it was just like an infection. And then you can see the rashes that I had on my tongue. A lot of times people hadn't noticed that when the doctors, they was like, wow, we've never seen this before. My fingers were black and everything, but different strokes for different folks. And that's what one of the things that I had to deal with. And one thing I also want to say that I had no pain in the midst of any and everything that I went through. To God be the glory. She said she had no pain. I had no pain. Every time I would go, they're like, rate your pain. I'm like, 0, I don't have any, you know, should I have some? And another thing I want to mention that the medications, when you're diagnosed, you go through so many tests. I had gone through colonoscopy. I mean, it was just your heart test, just so many different tests. Every time I'm like, okay, face with family, I'm at the hospital again. I'm having this test run. I was just sharing just to let everybody know it's normal. But every time they go through any procedure, the chemo, I had no pain. Let's see, after I let my body heal, I scheduled the lumpectomy, and it was, let's see, that's Dr. Light. That was my surgeon. And as you can see, people supported me so much. They had Team Liz shirts. And then on the other picture, that's Amber Myers, one of the former 5-year survivors. She's a survivor, not formal current 5-year survivor. She was one of the ones that I met on social media. She was following my page and someone had told her to reach out to me because she had already had surgery. She was going for the chemo. The chemo seemed to be the biggest deal for everyone. And going back, when I was going through chemo, I prayed and asked God to give me someone to fight with by the kind of advice of the my mentor that transitioned. And I woke up in the morning, it was someone in my inbox, and her name is Dorlita Adams. I want to send a shout out to Dee too. And when I say we fought together, we fought together. She was struggling. Everybody seemed like they were struggling but me. Even though, you know, we're all going through it, it's just the attitude that I had taken. And I told her, I'm like, free yourself. Release yourself, go out, be careful. You know, life doesn't stop. I mean, you know, it stopped for a moment if you're going through your treatments and you're dealing with things, but after that, you go down, you get back up. It was like a up and down. But when you up, you need to be up. We need to be experiencing life. And that's what I was doing, even in the midst of everything. But I was also being careful. I had an admin. And she would just make sure if people were coming to see me, hey, you know, you have to come in with a mask. And like I said, that was before COVID. So I'm a pro when it comes to wearing the mask. Okay. Let's see, moving along. Even though that I have emotional moments, I've often became the person to lean on and people to release their emotions and to talk about their battle with cancer. But however, my problem that I had, if it was a problem, was asking people to help me was very difficult at first because I'm used to helping everyone, being there for everyone. But I had to learn to be comfortable with being uncomfortable. And that's a phrase that I often use now. People are so helpful and loving. You just never know when people see that you were going through, especially prior to COVID, they were just willing to give you a hand just to help you. I've gone many places, and around that time when I was fighting, Black Panther came out. So, you know, the women was just cutting hair, just wearing ball. They thought I was one of those women just cutting my hair, just wearing ball. And I had to tell them, there was a guy, you know, that I had to tell him, like, no, I'm fighting cancer. He's like, oh, I love that you're rocking the ball. I'm like, I have no choice. I'm fighting cancer. And he was just like, what? That gentleman could not believe me. He laughed like, no, you're kidding. Until I showed him my port. He was like, oh, wow. But I started wearing and rocking the ball before Black Panther. That's another little plug that I like to put on myself as well. So in my support from the beginning was parents, best friends. Lincoln University even went pink for me. Sorority sisters, the students, because if I'm encouraging you, and I'm in the role as assistant dean of student and as the registrar, I'm encouraging you that you have to graduate, you have to finish the course no matter what, in the midst of whatever obstacles you're dealing with. How could I deal with my own battle and go hide in a shell? It just wasn't for me. It wasn't for me, and I didn't allow it. And I thank God that voice that I heard to say, no, you're gonna go live and you're gonna share your story with everyone. One of the things that physical therapy, because I did have cancer removed from my lymph nodes. I had 10 removed, 2 was cancerous. So I didn't think that I'll ever be able to lift this hand again. So they put me through physical therapy. So that's just some pictures of me going through physical therapy, and the exercises that she was saying, those are still the exercises that we do today. So what they were doing in 98, they still doing in the 2000s. And then also me just showing, just being extra to let you know that I said I'm not my hair, to let you know that the hair will grow back. And those people, there were so many people that even asked me like, hey, are you gonna keep your hair bald? You look well with your hair cut down bald. I'm like, no, I'm glad to know that. I'm gonna let it grow back and do whatever it is it does. It has grown back, even though I'm wearing braids today. It has grown back. You can see it's long enough for me to wear braids. Afterwards, it's time after the radiation, after the physical therapy. I was doing physical therapy and radiation at the same time. I'm holding this bear. This was the bear that we all put on social media, and I let social media name her. This was Hannah. And I had Hannah because I told you, and I mentioned before, when I went through chemo, it was so many people. And the first time I rang the bell, it was so many people at Goldsmith Cancer Center. We had to stop people from entering the building. They had to enter the outside in order to support, because we were releasing balloons. You know, it was like a big occasion. And so many Lincoln University students that I did not know was just showing up in droves. It was just like, oh my goodness. They were like, who is this person that's in here? And then some people was like, is this the president's daughter? You know, they were just trying to figure out, with all the love and the support that I had, people were just coming on top of my family. And my family would drive from St. Louis to every treatment. That's one thing I can say, that it was people, local people offering support. Hey, can we come? Can we do this? I was turning people down. Can I put you on a wait list? You know, because I had so much support. But my family took on the mantra like, hey, she fighting, she's strong, she's going through this. We're going to be there for her, weather permit. And yes, they were able to make all of the treatments. And it would be different family members surprising me. I would just never know. It's almost like I was excited to go to chemo because I'm excited to see who's going to show up, you know. So I'm raising my blood pressure just because I'm crying tears of joy, like, oh my goodness, my favorite aunt came, or oh, my nephew came, you know, and various ones coming in. So after the radiation, so that's Hannah. Going into radiation with me, you can just see me on the table and holding Hannah, because I felt like support was very, very important and very needed. That I would take Hannah in the room with me, and I would just sit her in the chair as she watched me. She was that support of all those other people in the form of a bear. But one thing I want to tell you, going through radiation, it takes more time putting your clothes on and off than it actually does going through the actual radiation. The radiation was so quick. They put like a little mark on you, they tattoo you, and they know where that radiation needs to aim. And it was amazing. I'm like, man, I'm done. I'm done. Even though it takes some of your energy. And one thing they had to tell me, because it was in the summertime, as you can see, July 3rd, that when I would go outside, if I was going outside for any trips, I had to make sure I keep my body covered. We don't need any additional sun or anything coming since the area is already being treated and radiated. And that was something that I learned. But Hannah and I held through, and I still have Hannah to this day. This might be a disclaimer. This is some of the results of the radiation, to where it was burning my skin and so forth. However, it didn't hurt. It was just a little discomfort. But the thing is, they provide you with a cream, and the cream that I had, I put tea tree oil with it. And when I say I put it on, it just cleared everything. My skin went back to normal, because people on social media like, hey, what are you using? Because I was transparent with everything. I was showing them enough without showing everything. They were reaching out and asking questions. What are you doing, and how are you going about doing this? I'll wrap it up. Conclusion. 5 years later, I lived through my testimony. I'm traveling, going anywhere, telling my story. I had to cater this to a PowerPoint, so it was a little different for me. But also, I have a run every year, and this is a picture of the run, just some of the people that was here at the end that I have on the Lincoln University campus, because I want to bring awareness to everyone. This is a picture of everybody celebrating with me just actually 2 weeks ago. It was at the link. And one thing I can do, it's a run and or a walk. I would make sure I connect with the Miss Deborah Jenkins and Miss Yvonne, and let you all know, because even if you're like, hey, I can't walk, you still just want to be there to support. I have open arms, and somebody, believe it or not, as the result of this walk, reached out to me and wanted to do some partnership. And what I do is, with the foundation Passion for Pink Change, those that get diagnosed with breast cancer, we give them care packages, baskets, and the whole 9 yards, because that's one thing I want to do, is bring awareness. All right. Thank you.
Did I tell you that we had 2 diamonds from Lincoln University? Aren't they amazing, ladies? Please, round of applause again for both of them. Big round of applause. All right, now's the time to we're nearing the end of our lunch and learn. However, we do have time for some questions and comments. And so at this time, I'm going to go to St. Louis. St. Louis.
Hey, Liz, this is Marla.
Hi, Marla. That's my
Girl.
classmate.
Yes, thank you. Phenomenal presentation. Thank you for sharing your experience, but at this time, St. Louis does not have any questions.
Thank you.
Thank you. Southeast Missouri. Any questions or comments?
Thank you, everybody. Thank you.
Thank
you. Thank you.
Thank you. All right. Thank you all thus far for attending and hanging with us.
Yeah.
Well, let's go to Casey. All right, Casey.
All right, Sarah.
All right, Sarah.
Yes, to you. Yes. We have no questions or comments. Thank you.
Thank you.
Thank you. Central. If you're Zooming by phone or in person, any concluding remarks? Go on. One more time, Ms. Carol. Get your mammogram.
Because early detection is best.
Right.
All right. Well, again, like I said, we are, when we were talking about this and planning this, and I was thinking, I said, yes, of course, this is Breast Cancer Awareness Month, but ideally, we knew, and Mrs. Yvonne was mentioning, who are the possible presenters.
Thank you.
And she said, yeah, I'm telling you. She said, and she said, well, contact the School of Nursing for the medical side of this, Dr. Jennifer McCord. And she said, I want the survivor to be, of course, our concluding presenter, Miss Liz Montgomery.
Oh, thank you. Miss Liz, can we ask you one question? I overlooked the person.
Okay.
Okay,
I'll be a question, okay.
Okay, he said, what kind of diet are you on as far as protein and, or what kind of protein diet or any diet you're on? Thank you.
Generally, thank you. Afterwards, I'm glad you asked that question. That's a good question. Even though statistics doesn't say, I switched to all no aluminum deodorant. I drink alkaline water. Got like a Fuji today, but I generally drink the water. I don't eat, and I haven't had pork in years. I eat red meat because one of the chemos they were threatening to not give me because of my counts were low. So I had to eat some red meat. My brother Hop took me out to get a steak. It took me 5 days to eat it, but I was able to digest it to get those numbers up. So I'm not really big on any red meat. So if we had to say, I'm good with the vegetarian, pescatarian, but if I eat some chicken or red meat maybe once a week is something that I strategically just try to place in my diet.
Thank you.
Thank you.
Thank you. Are there any more questions going once? All right, Mr. Ernestine.
I don't have a question. I have a, something I'd like to say to Ms. Jennifer.
Go
Yes,
right
ma'am.
ahead.
Miss Liz, I want to thank you so much because you are an inspiration for so many.
Thank you.
And you know, it'd be good if we had a recording of this.
We do.
Because somebody, someday, somewhere is going to need to hear this.
Thank you.
And I just want to thank you. I just love her. I went through this journey with my first cousin. She had the rash on her tongue, the burning sensation, not wanting to eat. We shared a lot of tears together.
Yes, ma'am.
So I know, you know, I was there with my cousin. I walked the walk with her.
Thank
And
you.
I appreciate you.
Thank you. We appreciate caregivers and everyone too, and those that support us.
And this
Thank
lunch you learned, am I correct, Ms. Andrew, has been recorded?
Awesome.
Yes.
Put it on our YouTube channel and share it with everybody.
Okay.
Absolutely.
Thank you. Thank you for your help.
Thank you.
Absolutely. And before we conclude, I have some announcements I need to make. And before, since our presenters, they really stayed from the beginning to the end. Give them another round of applause. Rare. What they say, but that's LU. Yes, all right. So if you two can stay for a few minutes, are you in a hurry? Okay, good, because we would like to briefly interview you. Mr. Andrew, let me know when you're ready to, you know, do that at this time. But at this time, I'm gonna go ahead and make these quick announcements. The next Paula J. Carter Center's Lunch and Learn will be scheduled for Wednesday, December the 13th, 2023. We will definitely be sending out information around the state and notifying the satellites again. Thank you guys for attending as well. Awesome attendance from around the state. All right, and then my second thing I wanted to announce is about, of course, if you are 65 and older, the Medicare open enrollment period began October the 15th and it'll end December the 7th. And the PJCC, we are a partner with the Missouri State Health Insurance Program. They're formerly known as CLAIM, and they have counselors for free. They provide unbiased Medicare counseling, and the number is 800-390-3330 for free help. Again, that number is 800-390-3330. And before we go around and say goodbye to our colleagues and our peers, I want to thank you all for attending, and we will be evaluating both of the presentations. And if you are by Zoom, we are by phone. We will call you. If you have a presentation, please go ahead and complete those. We look forward to your feedback because we really, truly do look at what you say. It is so important. Your input is so important for what ideas you can give to us and what presentations that we need to bring to you. So at this time, let's go around the state and say goodbye to our fellow peers and our colleagues. Southeast Missouri, goodbye. Thank you for joining, guys.
Bye.
I enjoyed it.
All right.
Thank you. See you next time. Get
All
your
right. Thank you, Booty. Okay. Let's move on up that virtual highway to St. Louis. Bye, St. Louis. Thank you for attending. Let's go to the west. KC. Goodbye, Kansas City. Thank you for attending. All right.